back up, we've talked about neck pain. The causes of neck pain can be many. It can be from the muscles around the neck. It can be from the discs rupturing, their pain fibers around the disc. It can be from these joints. Over time, as there's more motion of the joints and as time passes, these joints become arthritic. And I'm glad I'm doing this presentation for the Arthritis Foundation because that's what happens over time. The joints start to wear out, and when they wear out, bone spurs are created, and those bone spurs can eventually cause pressure on the nerves. Because what happens is there's a channel here through which the nerve comes out. When this bone here starts to overgrow or create a bone spur, it can start to pinch the nerve. And when it pinches the nerve, it causes pain shooting down the arm. So we talked about two conditions that can cause pain down the arm, something called radiculopathy. One of them is a disc herniation pressing on the nerve. The second one is when a bone spur or arthritis in the neck pinches the nerve and causes pain down the arm. There's a third condition that can occur in the neck, and that's called cervical myelopathy. Myelo refers to the spinal cord. Myelopathy, the pathy, is part of the pathology, meaning bad. So myelopathy means bad spinal cord. And what do I mean by that? Well, you have the spinal cord in the center of the neck. This is the back of the neck here with the spinous processes. If you put your hand on the back of your neck, you can feel these bony prominences. Well, these are the bony prominences. Deep down is the spinal cord. The spinal cord sends signals to your entire body. Well, what happens if one of these discs shoots out and presses on the spinal cord? What can happen is you can have injury to the spinal cord, typically over time, or it can occur all of a sudden if there was a huge disc herniation pressing on the spinal cord. Now, what happens when you have pressure on the spinal cord? Typically, people aren't even aware of it if it occurs over a long period of time. What people sometimes notice, and it's more common as we get older, so it's more common in people who are 50, 60, 70, 80 years old. What happens is the spinal canal compresses, things start to go around, like the discs and the bone spurs, or the radicular bone spurs, will press on the spinal cord. And what will happen is people will discover that the function in their hands, the functionality of their hands, their fine motor skills, their ability to tie their buttons, to write, to sip their coffee, becomes very limited, and they lose that function. The other thing that people notice is that their hands become numb and tingly and can sometimes have a burning sensation or clumsiness in their hands. This can also progress since the spinal cord controls the function in the legs. Some people will also have difficulty with walking. They feel a sense of imbalance. They feel like they're drunk, that they can't walk correctly, that they're losing that control of walking. So, that's another thing that can occur. And in a later sense, it sometimes can affect your bladder function. But that's when it's really toward the end of the spectrum, where people may have incontinence because of it. But that's typically very uncommon, because it's usually picked up before that. So basically, we talked about three different conditions affecting the cervical spine or neck. The first one is neck pain. Neck pain is due to arthritis in the joints. It's due to degeneration or wearing out of the discs. And it's due to a muscular injury, like a sprain in the neck. Like people who commonly say, Doc, I woke up and my neck, felt very uncomfortable. That's typically a sprain in the neck. So that's called cervicalgia or neck pain. That's typically treated with anti-inflammatories, Motrin, Aleve, ibuprofen, physical therapy, rest, icing, and that's quite effective, and it doesn't usually last a long time. The second condition we talked about is cervical radiculopathy, and that can be due to a bump on the head, or it can be due to a disc wearing out over time. When the disc wears out, it can cause initially neck pain, and then afterwards, sometimes people will initially get the neck pain, and they'll say, Doc, the neck pain's here and it radiates into my shoulder blade. That's referred pain. The pain starts in the neck, but it goes into the shoulder blade. However, over time it can progress. If a disc herniation presses on the nerve, what can happen is it can send pain all the way down the arm. So the typical presentation that people come in and say, "Doc, my neck hurts, it went to my shoulder blade, a few days later it shot down my arm and into my hand." And it can also get down into the fingers as well. That's the second condition. The third condition we discussed is myelopathy, and that's basically when there's pressure on the spinal cord. Now, how do we treat these conditions? Typically, we like to use conservative treatments, and those treatments are things like therapy, medications, anti-inflammatories. If those are ineffective, then therapy may be beneficial. Sometimes with a pinched nerve in the neck, a steroid injection can be delivered, and steroid medication can go down to where the nerve, basically to decrease inflammation around the nerve and relieve that arm pain or the pain going down into the arm. If those treatments are not effective, then surgery is a highly effective treatment with regard to cervical radiculopathy or disc herniation. What's typically done is we go through the front of the neck and we remove a disc. And by removing that disc, we take pressure off the nerve. We also remove bone spurs. By removing bone spurs, we also take pressure off the nerve. And then what we can commonly do is we take a plastic spacer and fill it with the person's bone and cadaver bone, and then we place that within the disc space, and that allows the bone to heal over time, and it fuses the spine. And that's a very effective treatment for a pinched nerve in the neck. For something called myelopathy, where the whole spinal cord, and you can imagine if you have like several levels that are compressed in the spinal cord, we have to relieve that pressure. So here's the spinal cord in the center, and what we typically do is we remove the bone along the side here, and then that takes the pressure off the spinal cord, and we have to stabilize the neck, typically by putting screws into the bony prominences over here, and then rods to stabilize the spine. And that's very effective in terms of relieving the myelopathy or the pressure on the spinal cord. So I hope some of these topics are helpful to you in terms of your neck pain or any shooting pain down the arm that you may have. The key component to keep in mind is that as we get older, our body wears out and degenerates. And that degeneration or arthritis can basically cause neck pain, pinched nerves, pressure on the spinal cord. There are a lot of conservative treatments that are highly effective in relieving those symptoms. However, if those conservative treatments fail, then surgery is a very, very effective way to relieve that pain and those symptoms. Additionally, surgery is frequently used for patients who present with weakness or clumsiness, difficulty walking. Those patients can forego conservative treatments in a lot of cases because they need surgery more acutely to take pressure off the nerves and spinal cord so that they don't end up with permanent weakness or wasting of their hands and decreased use and function of their upper extremities. I hope you found this talk to be effective. If you have any questions, feel free to contact me through my website at www.drharoun, that's DRHAROUN.com, or you can call my office at 410-646-4800. I thank you.